My name is Olayinka Suberu, a student of Doctor of Nursing Practice at the University of Texas, Arlington. I'm presenting to you today my topic, Evaluating Leadership. I'll be using a PowerPoint. My PICO question is, in postpartum patients who are breastfeeding, what is the effect of early prenatal breastfeeding education from healthcare professionals on exclusive breastfeeding compliance compared to delayed teaching? The definition of the PICO: the participants, the postpartum patient who are breastfeeding. The intervention will be early prenatal education from healthcare professionals on exclusive breastfeeding. And I'll compare the problem to the intervention, which is a delayed teaching in antepartum and postpartum patient. And the outcome measures, I will use a survey, a paper survey for my measures, and also a scaled questionnaire. And the name of the scaled questionnaire will be Breastfeeding Self-Efficacy of Exclusive Breastfeeding. The scaled questionnaire will be a breastfeeding self-efficacy or the exclusive breastfeeding, and also a paper survey. The gap analysis. At my workplace, the gap for these problems are limited access to early and antepartum breastfeeding education. And another gap is a poor exclusive breastfeeding compliance in mothers who experience delayed prenatal education on baby-friendly practices. The evidence for this intervention will be early prenatal education from professionals on exclusive breastfeeding compliance. Another evidence of intervention is 10 steps to baby-friendly, to promote, to protect, and to support exclusive breastfeeding for 6 months. Another evidence for intervention is a peer group setting with breastfeeding support and education. The strength, the weakness, the opportunity, and the threats for this project. The strengths are breastfeeding friendly hospital. My organization is a breastfeeding friendly hospital, and the outpatient clinic and support group will be a strength for this project. The organizational support. The weak and breastfeeding peer counselor program will be the strength for this project. The weaknesses are lack of breastfeeding education for the medical providers. The not treating mothers and babies together as a dyad is another weakness. Lack of timely intervention is a weakness to this project. Lack of enough space to pump and breastfeed in public is a weakness. The opportunities for this project are better communication of resources for medical providers and mom. Another opportunity is a prenatal and family education. Increased duration of breastfeeding is an opportunity for this project. Referral to week if needed. The threats are incorrect breastfeeding information or lack of support from medical providers. Returning to work early is also a threat. Lack of family support is a threat. Lack of education for breastfeeding women is also a threat. And delayed project approval may be a threat to this project. And the budget for this project, the projected budget, the total cost will be $135. The total budget will be $375. The breakdown goes as follows. The material will cost $150. The staff time, the education for staff before the project starts will cost $130. The survey, the pre and post survey would be estimated to be $70. And the flyers, the colored flyers that will be posted all over the clinic will be costing $25. So bringing the total to be estimated as $375. What makes me the best, what qualifies me to be the best person to do this project, as follows. My qualities as a project manager goes like this. My vision, I have a good vision for this project, for breastfeeding, exclusive breastfeeding for postpartum moms. I have good integrity among my fellow workers. I'm enthusiastic, and my enthusiasm about this project is very high. One of my skills are problem solving, competence, intelligent. I can motivate my other employees to do this project, to bring it to a success. I have organizational skills. I have a delegation skill. I have effective communication skill. I can negotiate with the stakeholders, my clinic manager and other employees, and I'm a team builder. And who are the team members for this project? My team members will be physicians, my clinic manager will be involved, all my other colleagues, my and nurse practitioners will be involved in this project. The lactation consultant will be involved. I'm involving the registered nurses. I'm inviting all the women's health educators, and also not left out are the medical assistants. And this will bring me to the end of my lecture, of my presentation about my topic, evaluating leadership on exclusive breastfeeding for moms for 6 months. Thank you.